Baby teething process and treatment. Welcome to my channel. This is Alema Health Matters. Is this your first time? I urge you to subscribe, like this video and also share. You can also comment on the comment section and share your views about this video, and don't forget to hit the notification button so that you will be notified every time I post a new video. This episode objectives are: what is baby teething, signs and symptoms for teething, how to diagnose teething process, and lastly, how to treat teething process. What is baby teething process? Baby teething process is a process of primary teeth cutting through the gums and appearing in the baby's mouth. The baby's mouth is an exquisitely sensitive portal connecting the world around him to his developing mind and body. This is because the baby uses the mouth to meet the mother for hunger satisfaction, for comfort between feedings, and to explore objects in the widening world. Hard teeth protruding into this soft, sensitive orifice, it is a major event in the life of a baby. For a baby, the intrusion of a hard, sharp tooth through the tender, swollen gums can be quite an adjustment and uncomfortable. Who gets teething? The first tooth is the one that causes the most discomfort, or the big molars when they arrive. But for many babies, working on several teeth at once is the worst experience. The average time for the appearance of the first teeth ranges between 5 and 7 months of age. But sometimes the first teeth might come in as early as 1 month of age, or come in late when a child is almost 18 months old. Any of this stage is normal, but it's good to consult with a pediatrician if there is no teeth that have appeared by 1 year of age. Most of the time, it's the lower teeth that come in before the upper teeth. But with girls, teeth eruption is earlier as compared to boys. Delayed eruption of all teeth may be the result of a nutritional problem such as rickets, or a systemic condition such as hypopituitarism or hypothyroidism. Children will again have all the symptoms of teething when the first permanent molars come in around the age of 6 or 7 years. What are the symptoms of teething? The symptoms vary from child to child, but sometimes teething can cause discomfort, irritability, low-grade fevers, increased saliva and mucus, or greenish loose stools. Parents may notice their babies drooling and bringing their hands to their mouths. Teething is not contagious and usually starts about 2 months before the first tooth erupts and proceeds intermittently, and all of the primary teeth are usually in by 20 to 30 months of age. But most children do not have major symptoms with each tooth. How teething is diagnosed? Teething is diagnosed by observation. High fevers or significant irritability should not be attributed to teething, and other causes should be sought. Also, the pain from ear infection is often mistakenly identified as teething pain. How teething is treated. Teething babies tend to bring their hands to their mouths because of the pressure on the gums. A massage from someone else tends to be more soothing when it comes to teething, and a great way to comfort a teething baby is to rub the gums firmly and gently with a clean finger. At the beginning of the massage, sometimes it's a bit uncomfortable, but babies get increasingly relaxed as the massage continues. Providing a cool, safe thing to chew on is another effective way to treat teething. Some babies are delighted with smooth, hard objects like the handle of a hairbrush, but whatever you select, be careful that the object is not something the child might choke on. Lastly, benzocaines and viscous lidocaine teething gels are not recommended in teething process because usually they reduce pain, but they can have serious health consequences, including rarely death, which can be caused by these two teething gels, and therefore they are not recommended. That is the last part of this discussion. Kindly subscribe and like this video.